This is Dr. Michael Trainer. I have created this video to discuss cervical disc replacement surgery. I will discuss the risks and possible complications associated with disc replacement surgery on the cervical spine or the neck region. In addition, I will answer frequently asked questions and also describe expectations and instructions for patients who will be undergoing the cervical disc replacement surgery. The first risk we discuss with patients is the risk of infection. Anytime a patient has a cut in the skin, they are at risk for infection. Infection is extremely rare following disc replacement surgery on the cervical spine. Patients will be given IV antibiotics during surgery to prevent infection. Patients will not require oral antibiotics or at-home antibiotics following the surgery. The second risk we discuss regarding cervical disc replacement is blood loss. Blood loss during cervical disc replacement is very minimal. Therefore, it is not a significant concern or risk. It is extraordinarily rare that a patient would require a blood transfusion following a disc replacement on the cervical spine. The greatest risk with disc replacement on the cervical spine has to do with swelling. During the surgery, the patient undergoes general anesthesia. General anesthesia involves a tracheal tube that goes into the lungs, and the incision is performed on the front of the neck, typically a small incision along the right side of the neck. Retractors are placed, and this can cause swelling, not only to the trachea, which is the windpipe, but also the esophagus, which is the food pipe, and in and around the soft tissues of the neck. Because of swelling, some patients might have difficulty with swallowing, which is called dysphagia. In addition, some patients might feel some shortness of breath because of swelling. We take steps for the patients undergoing this surgery to decrease swelling. The first step is to use ice to the neck. We recommend ice packs on the front and the back of the neck for 20 minutes at a time every 2 to 3 hours following cervical surgery. The ice pack regimen should be performed for at least 3 to 5 days following the surgery. Patients do not need to wake up at night to ice, but they should ice for 20 minutes every 2 to 3 hours while awake. In addition, patients will be given a 5-day prescription for prednisone following their cervical surgery. The prednisone is a steroid medication that decreases swelling and inflammation. Unfortunately, with the swelling and inflammation, patients can have increased pain, and therefore decreasing the swelling and inflammation will also help pain symptoms. Because of the possible difficulty with swallowing, we recommend patients have a soft diet for 3 to 5 days following the surgery. Some patients might have minimal swelling and may be able to discontinue the soft diet very quickly. Other patients may need to extend it more than 3 to 5 days. We recommend ice chips and cold drinks. Things like smoothies or milkshakes can be very beneficial, as the cold fluid can also help swelling from inside. Thin liquids and solid foods are usually most difficult to swallow. So food items such as smoothies or yogurts or pudding or applesauce, oatmeal, scrambled eggs tend to be the foods that are most easily swallowed following the surgery. If patients are not experiencing swallowing difficulty, then they can advance their diet as tolerated and as quickly as they feel comfortable. But swallowing difficulty is not in the least bit uncommon following the surgery. Of course, any surgery that involves the cervical spine has risk to the spinal cord as well as spinal nerves. Spinal nerves in the neck travel down the arms, and therefore patients may have numbness or tingling symptoms down the arms. Most oftentimes patients are experiencing some of those types of symptoms prior to the surgery, and oftentimes they are much improved following the surgery, but do not be alarmed if you experience some of those symptoms. During the cervical surgery, precautions are taken to protect the spinal cord and the nerves. One precaution is the utilization of what's called intraoperative nerve monitoring. Basically, what that means is during the surgery, once the patient is asleep, a nerve monitoring technician will place needle probes from the skull all the way to the toes. Those probes are hooked up to an apparatus that is able to monitor spinal cord function and spinal nerve function. As we are working near those structures, this way I am always aware of any changes in function during the surgery. This is the safest way to protect the nerves and the spinal cord during surgery. There is a risk of injury to the spinal cord during any cervical surgery. Thankfully, that is a risk that does not occur very often. As a matter of fact, I have never personally had a patient have a spinal cord injury during a cervical surgery, but it is certainly something that we explain to patients. When we perform the disc replacement surgery, patients may have some persistence of pain or nerve symptoms that we cannot eliminate. That is also certainly a risk of the procedure. If there are any complications with the replacement parts that need to be addressed, then that would be a risk that patients need to be aware of as well. Following the surgery, in the post-operative visits, x-rays will be taken and examinations will be performed to ensure that the disc replacement is unchanged from how it was placed during surgery. In terms of the surgery itself, it typically takes about 1 hour to perform if the disc replacement is for only one level. A level would be, for example, replacing the disc between the 5th and the 6th cervical vertebrae. If a patient has a 2-level disc replacement, it would typically increase the surgical time by about 45 minutes to an hour. So in that scenario, it might be performing a disc replacement at C5-6 and C6-7. In terms of utilizing a model, this is a small model of the cervical spine. Cervical spine would sit in the front in this fashion, and the side profile would be here. So again, if a patient undergoes a 2-level disc replacement, it would be removing the disc between C5 and C6, and then the disc between C6 and C7. Such a surgery would typically take about 1.5 hours to 2 hours. Again, if there was 3 levels, which is very rare, it would increase the surgery time. Again, the incision is typically along the right side of the neck at the level of the replacement. The surgery again is performed under general anesthesia, and nerve monitoring is performed during the surgery. The vast majority, greater than 95% of these surgeries are outpatient surgeries. They may be performed at the surgery center or they may be performed at the hospital, but the vast majority of patients will be allowed to go home the same day. Following the surgery, the restrictions are to avoid excessive neck bending, twisting, or lifting greater than 10 to 15 pounds for the first 10 to 14 days. Patients can certainly move the neck up and down and side to side as they tolerate. We would not recommend significant motion at that speed or velocity. However, gentle motion is fine. Patients are not required to wear neck braces or collars after disc replacement, because disc replacement is basically allowing for neck movement with the replacement. Patients will have a clear dressing over their incision. It's a saran wrap type covering with a gauze underneath. The closure of the wound is with a plastic surgery closure, so there are no sutures that need to be removed. they will simply dissolve. Patients are allowed to shower on the day following their surgery. Typically, patients can keep the dressing on for the first day because it is waterproof and shower. The second day after surgery, we recommend removing the dressing. It will be steri strips over the wound. Keep the steri strips in place. Simply remove the outer covering and the gauze. You can then get the incision wet, and after the shower, make sure that the wound is nice and dry. As a matter of fact, if you need to let the air dry the wound for an hour or so after your shower, that's fine, and then just place a clean, dry dressing over the wound. The incision is typically only about an inch, maybe an inch and a half, but not very long. Do not put any gauze or ointments or vasitration over the wound, just a clean, dry dressing once a day. If the wound is still slightly wet, you can also use a hair dryer on a cool setting, low, to make sure the wound is dry prior to placing the dressing. If you place the dressing and the wound is still wet, it will often have a little ooze of fluid, and that can sometimes concern patients for infection. So again, we make sure that the wound is dry prior to placing the dressing. In terms of activity, again, avoid excessive neck bending, twisting, or lifting, but we recommend light cardiovascular exercise the day following the surgery. Patients can use a treadmill and walk. They could use an elliptical trainer. They could walk outside. They could use a stationary bicycle. They should avoid heavy lifting greater than 15 pounds with the arms. Jogging and running is not recommended right after the surgery. Patients will be instructed to follow up in the office 2 weeks after their surgery. The 2-week follow-up appointment can be arranged at their preoperative appointment. Patients will typically be seen 7 to 10 days prior to their surgery in a preoperative visit, at which point all of the present instructions will be reviewed. Patients should then be seen at 2 weeks following their surgery, at which time x-rays will be taken and the wound will be examined. Again, no sutures need to be removed. Patients will then be instructed that they can slowly increase their activity. If patients require physical therapy, it will be prescribed at the 2-week follow-up visit, or depending, it may be prescribed for several weeks later. Some patients do not require additional therapy. Patients will then be seen at 6 weeks following the surgery and at 12 weeks following the surgery. If patients need to be seen more frequently, then they simply need to call the office and will be scheduled accordingly. We do not want patients to go to the emergency room if they have any questions or concerns. Please call the office first, and we will notify the patient and have them come to the office. If it's the nighttime or the weekend, call the office. I will be contacted and I will call the patient myself to answer any questions. Patients will be prescribed the prednisone following surgery and also typically pain medication if it is needed. If a patient is not having significant pain and the prednisone as well as the ice is helping, they can use Tylenol or Advil, but they will be prescribed pain medication. Again, the pain medication is to be taken as needed. The prednisone should be taken daily as instructed for 5 days. That is a medicine we want the patient to take because it will decrease the swelling, and it will also significantly improve the pain. All of the present instructions will be available for further review, as the video will be downloaded to our website. If patients would like to review the present video, they just need to go to aosmlv.com. Again, aosmlv.com. They can look at the provider listing and click on Dr. Michael Trainer, and the video will be available under the cervical disc replacement. Thank you.